In other news, the Maine Department of Health and Human Services warned lawmakers earlier this month that payments on MaineCare, Maine's Medicaid program, may have to be capped if a supplemental budget is not passed. At the same time, at the federal level, Republicans in the U.S. House of Representatives are now looking to reduce spending on Medicaid in a new budget resolution. This chain of events has concerned some patients and healthcare workers about what could come next. News Center Maine's Caroline LaCour has the story.
It's natural for parents to celebrate their children's accomplishments.
Whoa.
For Ashley Boucher Kaywood, those celebrations for her 3-year-old son, Bim, are extra special.
Every single thing that a provider or a specialist told me that he wouldn't do or most likely wouldn't be able to do, that he continues to check off his list. It's just fills me with so much pride.
Bim was born at only 24 weeks old and stayed at the NICU for 380 days, requiring around-the-clock care.
Because of course 24 weeks is the age of viability, so the earliest at which they expect that a kid could survive.
Underdeveloped lungs meant he had to go through a tracheotomy to help with breathing. At one point, Ben needed to be on a feeding tube and a ventilator 24/7.
It was a long and windy journey from the day of his birth until he finally came home. But knock wood, thankfully, since he's been home, he's been more or less sort of on the straight and narrow.
Bim has since shed his trach and now visits a developmental preschool for physical, speech, and feeding therapies.
Swimming in this tiny little diaper.
From adaptive equipment to medical supplies he needs, Kaywood says most of the tools that have helped Bim thrive into the kid he is today is thanks to MaineCare, Maine's Medicaid program. But now that funding is in jeopardy.
We're not asking for much, but if they don't want to fund this, I don't know how we're going to provide health care for the people of Maine.
Dr. Emily Hill, advocating for the Maine Medical Association, warns that limits on MaineCare or Medicaid programs could price residents out of care and overwhelm Maine's already fragile health care system.
If we're not going to fund the services that are going to keep Mainers at home safe and healthy, it backs up further and further in the hospitals.
According to the Department of Health and Human Services, there are more than 400,000 people on MaineCare.
We weren't set up for this. We didn't know this was going to happen. We didn't know we were going to have a disabled child. So there was no opportunity to plan for it.
She says even though Bim is doing better, she relies on MaineCare for his essentials, even with private insurance. She's worried for other families in similar situations.
Well, I feel incredibly disappointed that these lifelines are not being protected and that we have to worry.
In Portland, Caroline LaCour, News Center, Maine.